more estrogen than we do.
Hey everyone, thank you for joining us. My name is Leah Swanberg, and I have the immense pleasure tonight of connecting you, interviewing, asking your questions to Cindy Wasser of Hope Springs Fertility Law and Dr. Lee Brack of Create Fertility. So the platform tonight is going to be, we want to answer your questions. We're each going to give a brief overview of our function within the fertility space, surrogacy, egg donation, IVF in Canada. And then as you have questions, please pop them into the chat and we'll be happy to answer them as the webinar goes. We will give people a few more moments to join. I typically do a coin toss at this point to find out who's going to speak first, but I'm going to defer to my friend Cindy, who will share with you all things that you need to know prior to proceeding with a surrogacy or egg donation in Canada.
Thank you so much, Leah, for the lovely welcome. Hello, everybody. I'm Cindy Wasser, and I am the principal and founding lawyer of Hope Springs Fertility Law, which is the largest fertility law firm in Canada, and we're based here in Toronto. So over the last decade and a half, I have helped thousands of families realize their dream of making a family here in Canada. We represent intended parents as well as surrogates and donors. And our firm has several lawyers working with me as well as administrative staff. So we're able to take care of all of your needs legally.
Excellent. And when you mention intended parents, can you talk about who could be an intended parent in Canada, whether they live here or are outside of Canada? What are the rules around who can access fertility services legally?
So that's a great question. Thank you, Leah. Surrogacy and egg donation is perfectly legal in Canada. And because we are an accepting society, which is one above tolerant, I say, anyone over the age of 18 can access fertility treatment. The law across the country specifies that donors and recipients must be 18 and surrogates must be at least 21. And short of that, it's really a medical question as to how old they are able to do it. And because there is no maximum legal age, it really depends on medical aspects, which Dr. Lee Brack can address. But in terms of gender, marital status, there is no prohibition whatsoever because Canada is an accepting society. So you can be single, you can be married, you can be gay, you can be trans, you can be whatever you want to be, and it's just a question of paperwork in Canada, and there's a lot.
Excellent. Now, in terms of countries, I know that we have people from across the globe on this webinar. Are there any countries where surrogacy would be prohibited in Canada, egg donation would be prohibited, or do they need a known donor, an anonymous donor? What are sort of the rules when they come to Canada? Are they having a family based on the rules in Canada or the rules where they're located?
Excellent question. On my way over to Create Fertility Center for this webinar, I received a call from a woman helping a family member in Nigeria who wants to do surrogacy here with her husband. And so the number one issue is always get legal advice in your home country. And anyone who tells you not to start with a lawyer at home is someone you should be cautious of. So get your local lawyer. We're happy to make a referral if you don't know where to begin, but you want to make sure that you can bring the Canadian baby home. Your child is a Canadian tourist, and if I come and visit in whatever country, I can only stay a limited amount of time. Same with your child. So you have to give it your citizenship, and usually to do that in most countries, you have to prove that you're the legal parents. So that's a whole process to be done in your home country. But as far as Canada is concerned, anyone is welcome to come here to do it. And we'll learn from your local lawyer whether your country requires you to have a known donor, which is turning into the most popular thing, especially in the European countries. They're requiring it. And so we want to be in touch with that lawyer to make sure we put the right wording in the contract, that we put the right wording in the court order so that it's easiest for you.
Okay, excellent. And in Canada, there may be some Canadians watching. Is there any maybe tips like 3 things you could say to people that they just need to know right off the bat as they're looking for legal services? How can they vet that a lawyer in their community understands surrogacy, fertility, egg donation law? Is it a specialization as a lawyer, or what does that look like?
So lawyers are governed in Canada through their respective law societies of their province of residence or permit to work. And most law societies across the country will say that a lawyer shouldn't take on a case for which they don't have the experience or the knowledge, which isn't to say that a young lawyer can't do something that they've never done before, but they want to have someone mentoring. So surrogacy law is often managed by family lawyers, and it's a part of what their practice is. I think almost all of my colleagues do some sort of other work. Our firm only does fertility law. But I used to be a criminal defense lawyer for 30 years, so I bring a skill set, but I had to learn this law. But within the community of working with really good clinics and agencies, there is a small group of lawyers across the country who really know what we're doing and can really come in there when there's a problem. You've often called us to say, it's not even your client, Cindy, but we have this, and you have Dr. Liebrack. So you want that kind of lawyer. You want to make sure the lawyer's available. Because I have the staff and the infrastructure, we can provide a contract within 24 hours of getting medical clearance and a link to schedule a review with me or one of the other lawyers within sometimes that day, depending on the urgency. And we're available. We don't take 3 weeks to get back to you. Our office wants to respond within 24 hours. So those are the questions to ask the law firm: experience, expertise, knowledge, availability. And then you also want to be extremely mindful of Quebec and make sure if you are in Quebec, whether you have a surrogate in Quebec or surrogate in another province, you need to speak to a lawyer who is very familiar with the new rules in Quebec. And foreigners cannot have a surrogate in Quebec. You have to live there for a year if you're having a surrogate in Quebec.
Excellent. Thank you so much. Dr. Liebrack, if I could turn it over to you, and where would people who are coming to you, where would they get started? Do they see their regular family doctor first if they are a same-sex male couple, or a couple that that know already that they are going to be working with a surrogate or an egg donor? What's the first step at Create?
Well, we get referrals from all over the world to come to Create. We also do, of course, Canadians and other people in North America, USA as well. And the referrals would be people referring themselves, which is fine. If you know that you'd like to do this, you're a same-sex male couple, obviously you need to have an egg donor and a surrogate to have a baby, and we're happy to take your referral. And we also get many, many referrals from wonderful agencies and lawyers that we work with, like Cindy and Leah, and they will refer patients to us who will then work up from the medical point of view. So we really have many ways that you can access our clinic, and we're very happy to help any of you to start your journey.
Excellent. And when people are coming from outside of Ontario, how often do they need to come? What do they need to do when they come here? How invasive is this testing? Are you looking, can anyone of any age access fertility treatments? And what does that sort of initial appointment look like?
So the initial appointment is really a medical assessment. So we would do a full medical history, knowing your background, what kind of medical issues you may have, especially if it's a same-sex male couple. We'll want to talk about things that relate to their sperm and whether there could be issues related to that. We also would, for a heterosexual couple or single men or single women, we'd be looking at things related to the female and when there's a female partner, and we'd be looking at their whole medical history as well. So, and then the next step really is to do an assessment of them in terms of getting testing. So there'd be like blood testing to check for different kinds of infectious diseases. We'd be testing for genetics because we want to make sure, for example, that all of us carry some genes. So it's called carrier screening. We test for over 700 genes now to make sure to look at what you carry. The issue really is to make sure that the person providing eggs doesn't carry the same mutation as you, because that could cause a problem, a disease in the actual baby. So that's really the key for carrier screening. And nowadays, it's really done really routinely to make sure we're not going to be looking at a situation where you could have a severely abnormal child. We also will do examinations, like you need to have a physical exam, usually locally in your own country. You need to have certain questionnaires filled out that Health Canada requires, kind of like FDA in the US. We have a very similar type of system like that. So there's a number of things that we do. In terms of coming here, really the main time is for same-sex male couples and single men is to provide sperm. For the women, many times they do come here as well to be able to have a physical examination and ultrasound and assessment of their ovaries and their uterus that will help us to know what is the chances of it working and what are the things we can do to optimize your chances of having a baby.
Excellent. And when you talked about same-sex male couples, or even those in heterosexual relationships, and you talked about them providing sperm for analysis, can you work with someone who has a limited sperm count or HIV detected? Like, what would be something that would come up in that testing? Because I understand, people will reach out, they'll talk to the lawyer, they'll talk to the doctor. Are there ways they can work around any of those issues?
That's a great question. So if you're an international or far distant from the clinic, we would want you to have an assessment of your sperm locally, so we know what we're dealing with. If the sperm is very abnormal, very often we can work with it. Even if you have zero sperm, there are ways that we can extract sperm. So there's many different options for people that do have abnormal sperm counts and motility, which is the percent moving, and other types of abnormalities. So we can deal with almost any type of situation where there are sperm abnormalities. In terms of the other question that you asked, what was the
HIV.
Question? Oh yeah, HIV. So yeah, we test everyone for HIV, but HIV carriers are generally under medical care. They're on antiretroviral medications, and they're often undetectable levels in their blood. And those patients we can easily work with. There's no problem, because there's never actually been a case of transmission of HIV from either a sperm or egg provider to another person that's carrying the baby or the baby themselves. So it really is very safe, and it's something we can do. Surrogates, we always counsel them that there is no risk really of doing this when you're working with someone who's HIV positive that has undetectable levels in their blood. But there may be some that are worried about it, but we try to explain to them that it's really of no risk to them, and we work with HIV positive people all the time.
Excellent, thank you. I know during COVID, when people couldn't travel, your clinic had set up this sperm shipping, these kits that you would send to people. They would provide their sperm and ship them back. Now that COVID's over, is that still a possibility for people?
So that's a great question. And we were very inventive during COVID because travel was so difficult. So we developed a kit that you could actually freeze your own sperm at home, and through a video that you watch, and it's very simple to do. And someone would have to draw blood.
That's a lot of questions.
The video is informational on the process.
Yes,
it is not anything else.
It's not explicit. But anyway, and then someone draws blood, and we ship the sperm back to us, and the blood. And that has worked very well. In fact, we still have patients, people that are far afield in Australia and places like that, where coming here is not that simple, that are doing that. And we find that when the sperm is normal or almost normal, the results are excellent. However, if someone has a very low sperm count, we will prefer that they come here. But we can offer that service, no problem. And actually, interestingly, we're going to be presenting a paper, a presentation at the next European Society of Reproductive Medicine meeting that's happening in Amsterdam in a couple of weeks, about our results with that. And we found that people that ship sperm versus came here, there was absolutely no difference in their outcome. So we're very happy about that. So if it's something you would prefer to do, But we'd love to have you come here and meet you. But if you can't for work or whatever reason, and it's just too difficult to come here, we are happy to allow you to have the sperm kits.
Amazing. And now that we know people come, they do this medical testing with you, do they pick the surrogate first, the egg donor first? How do you know who would make a good candidate? You know, we often hear of people's sister who's 41 wanting to be their egg donor, or, you know, can you just sort of go over the basic criteria or parameters? It'd be great.
So I'll start with egg donor. Not everyone, of course, is going to need an egg donor. Then you may be using your own eggs and creating embryos and have a surrogate, for example. So there's many different combination permutations that happen. But let's talk about the people who need egg donor. Obviously, same-sex or single men would, or people or women that don't have eggs for whatever reason. So looking at egg donors, you know, normally egg donors are in their 20s or early 30s. They have to have a good ovarian reserve, we call it. So we test their anti-Müllerian hormone, a blood test that tells us if they're a good candidate. They have to be above a certain level to qualify to be an egg donor in a wonderful egg donor agency like Egg Helpers that Leanne Scott, or I don't know if Scott's on this as well, but they have their own egg agency, and basically they have to be above a certain level to qualify. But if you have a known donor that's your sister, cousin, niece, friend, and they do have a lower level, we can accept that, but you need to be aware that there be a lower success rate. And especially if they're older, the problem is as you get older, there are more abnormal embryos. So I'll give you an example, a sort of a guideline. When you're in your 20s, early 30s, it's about 30% of embryos will be abnormal. When you get to about 33, it's 40, and then 35, it's 50, and it gets worse after that. At 40, it's 70% will be abnormal. So the age of the egg provider is critical to the risk of having an abnormal embryo that really wouldn't be used in the process. So we do testing here for embryos to make sure that they're genetically normal in terms of the chromosomes, which is the most common abnormality in humans. It's too many or too few, and many of you might be aware about Down syndrome, which has an extra chromosome 21. So that's something we can easily detect in embryos and decide whether those embryos would be put inside.
And how is that testing done? Like, what is that test called? How can people research it?
Sure.
Does it tell you the gender? Like, give us the scoop on that test.
Yeah, so it's called pre-implantation genetic testing for aneuploidy, or the wrong number of chromosomes. And it's done on the embryos. We take a small sample of cells out of 100, like 3 or 4 cells, to be able to do this test. And we have one of the top genetics labs in the world here at Create in Toronto to do this kind of testing. And we can test for virtually anything. So if you have a specific gene that causes a specific disease in your family, that would be a different kind of testing. That's called PGT-M, or for monogenetic diseases. So we can also do that kind of testing. So there's an array of different genetic tests we can do on embryos nowadays to really make sure that an embryo going inside is, to the best of our knowledge, normal from a genetic point of view. We can't test for everything. We can test for about 95% of things, but some things are rare and some things are not genetic, and those are not things that we'd be able to test for.
So there's a difference between the testing you're going to do, the blood test before on the donor and the intended parents.
Yeah.
So we're going to make sure there's nothing there. And then testing the embryo later on.
Exactly.
And so just to locate myself on that, the testing we're doing before is different to the testing we're doing after on the embryo.
Correct. So before it's carrier screening to see what mutations you carry, as well as both the egg and sperm provider, and after is on the embryo itself, just to make sure it has the right number of chromosomes. Normally it's 46. We want to make sure it's not too many or too few.
Can I ask something about that, Dr. Libra?
Sure.
As it's become more common now for the donors to have their carrier screening done, and as the screening advances, we're finding so many things that I understand are not always serious. But it's recommended, is it not, that the sperm donor, often the intended parent, have their testing done in advance so they know if they're carrying or what mutations they may carry so that they don't match in
Oh,
advance?
so
or do you
before the
still wait?
donor.
It's
Do you
more
wait? Like,
it's
do you-
more ideal to make sure that, because the problem is there are different testing modalities. One might test 300 gene, one might test 700. So we want to make sure the same genes were tested in each person. Otherwise, it gets more complex and you have to do it all over again. So my advice would be to have the testing done after you've seen us, and we provide that kit that will be the same as the one the donor was
So
tested
you
with.
would send like a requisition or kit to the intended parents to get their
Yeah.
screening done locally.
Well,
So
the
if they-
testing wouldn't be done locally.
Oh.
They would have a kit. They would provide saliva,
you'd
which
get
is
it
their
back.
DNA, and then it would be shipped back, and then
Okay.
we have it tested.
So sperm testing can be done locally to make sure that they are both able, if they're same-sex couple, to both be providers or to get the fix they need in advance.
Yeah.
Then they should talk to you and get their kit, send it back to you to get their markers checked and make sure that they pick the right donor, or don't get involved with a donor who might share that marker. They've wasted 3 months.
Yeah.
So
And
it's fair for me to say that if I'm speaking to them earlier, and you won't get upset that I'm giving medical advice.
that's okay.
We're always upset you're giving medical advice. Okay, and then in terms of a
It's
gestational, in terms of a gestational carrier, which for those of you who are new to surrogacy, the term has really evolved from surrogate mother, knowing that this person has no intention to mother this child, and to call them a carrier. And it really seems to be what fits for most surrogates now, is they will call themselves a GC or a gestational carrier. If you could talk a little bit about what qualifies someone as a gestational carrier, what doesn't, and what you have seen shift in the last couple of years as we've expanded our view of surrogacy.
Okay, so from a medical point of view, the key things are that the person almost always must already have children. There are some rare exceptions to that we usually do very strict counseling on, but in most cases, they've already had children. They had no trouble with giving birth to a baby, and they're healthy. So those are all very important criteria that we look for. We also test their partner too, because they share bodily fluids. If they have a partner, some are single, to make sure their partner is not going to cause any harm to the baby during the pregnancy. And also we do what's called a urine toxicology test. We do that also on donors to check for things like, smoking cigarettes or taking drugs or any medications that could harm the eggs and affect the baby, or affect the baby during a pregnancy that a surrogate's having. And if they are on medications that could be harmful, we can usually find alternatives that are pregnancy safe. So that's a very important part of the process. And we also want to do a physical examination on them, check their uterus, if they've had cesarean sections, check the scar that it's healed well, check their blood pressure, all of the different things that are required for them to have a healthy pregnancy for another person, and also make sure that their health is protected too. We want to make sure they get through this in a safe way, because they're doing this to help you have a baby, not to put their own life at risk. And we want to make sure it's safe for your baby and for them.
Excellent. And one piece that I think is really important, and sometimes it's the agency that provides this piece, sometimes it happens at the clinic, but is the psychosocial assessment of the carrier. And really, I'm quite proud of the way that Canada manages this process. It isn't a pass or fail. It's yes, this is a great, I hear what you've said about your current family and your current life. I think it's a great time to move ahead. Or, hey, why don't you come back in 6 months? Maybe it sounds like you have a lot going on. Let's talk about supports we could put in place for you, how we could work with you over the next 6 months to ensure that you are ready for a pregnancy. Many of the surrogates in our program really feel supported. My suggestion to intended parents is to find a clinic that not only screens the surrogates themselves, but also provides ongoing psychosocial support of a counselor. Pregnancy is a big deal, and as intended parents, I know in speaking to them over the last almost 20 years, no one wants to put someone in a position that they're not ready to be in. And I think without those questions from a mental health professional around, social support, and is this a good time? As moms, and I know for myself, having been a gestational carrier, it was really important for me to do this. And I remember being told, wow, you have a very young baby at home. Are you sure? And really taking that away and thinking about it and deciding to sort of delay my process a few months because my child was under 1 at the time. She's now 21. And I really, can't stress that enough, that the screening process and, Dr. Liebrack mentioned toxicology screening. Oftentimes, for Canadians, we now view cannabis or marijuana as, equivalent to wine because it's sold in liquor stores in Canada. And it is, oftentimes people don't even think to sort of note that down. And so having that information, the clinic can really provide you great guidance in what is and is not pregnancy safe.
Can I ask a question of both of you
Yes.
on that note? How do you balance the privacy interests of the donor or surrogate who has an issue like this with the interests of the intended parent, who's your client and your patient, Dr. Liebrack, to know should they wait if it's a question of waiting for them to finish breastfeeding or something, or there's a disease or there's really a mental health issue of significance? Do you just say, you can't have this donor or surrogate, or do you say, she's got chlamydia, can you wait 6 months?
Right.
She's got a baby, can you wait another year? Like, how do you do that?
And I think, there are times where donors show up to screenings, just like gestational carriers, and they are pregnant and it is unplanned and they decide to go through with a termination prior to their process, or they're using cannabis and they would like a bit of time to not use cannabis, or, something comes up for them. And I really hold the gestational carriers able to make the decision that is right for them and their family, whether it's waiting, whether it's moving forward, whether it's withdrawing from a surrogacy program. I think that this idea of supporting women as gestational carriers has to be understood, that it is also supporting them in walking away. We want women or birthing people who are going through this process to be empowered and to be supported and feel well through their process. And if they don't, then we support them not moving forward. And on the other side, we hold intended parents able to decide, would I use cannabis prior to a pregnancy or as a mom? I might not. And so knowing now that my surrogate maybe didn't write that down because she didn't see it as a big deal, I have to look at that and make that decision for myself. Because an agency can say something, the gestational carrier can say something, but the agreements you make with yourself as an intended parent, that you are going to show up a certain way, that you're going to create boundaries around the relationship and around what you will and won't accept, happen far before the match. And so really going back and falling back onto that and pulling out your notes about what you wrote in terms of your journey expectations, I think is really important.
So the question that Cindy also asked was, how do you balance, the privacy of the surrogate or the donor with the importance that the intended parents know that there could be a risk to their baby or themselves, their child? So I think that's a really important question. And so in our consents, surrogates and donors must sign that they are willing to have information that's related to their donation, or the child that's going to result from the donation can be shared with the intended parents, so they can make a decision if it's okay for them to work with that person. If it's something that's completely not relevant whatsoever, something that happened in their childhood that's completely irrelevant, that would not be disclosed because it's not relevant. So it's really just things that are relevant. And so that's, I think, an important thing in this process. As an intended parent, you want to make sure your child is safe in the location they're in, and you want to make sure the eggs you get are coming from a place where there wouldn't be a high risk of abnormalities as well. There's a lot of gray zone things like mental illness. Someone's grandfather could have severe depression, but that's the great grandfather genetically of the child. That's probably irrelevant. If it's someone in their family, it could be that went through a death in the family or a breakup relationship. That's not genetic, that's just a situational thing. So we want to look for things that could be genetic, that could be passed on to a child. So those are really important things that we look for. And substance abuse, as we talked about, we can do the urine toxicology and check for that in the donors and the surrogates.
Excellent. We have lots of questions I would like to get to, just because
Yeah.
I don't want to miss anyone's question in our time.
We're just gonna peek in. So
I know
don't
I'm just
weird.
gonna lean in because I don't have
We're
my
looking
glasses
at the
on.
screen.
So someone is asking about current wait times, and I think it's really important to address this with respect to the people that have been waiting a great deal of time, because there are many clients who have waited a long time. And so typically the wait time in Canada, we imagine for a surrogate is 9 months. And when we look back during those 9 months, most intended parents are finding their egg donor, they're speaking to Cindy, they're going through the egg retrieval process, they're creating embryos. We used to say to people, wait until you have embryos to start looking for a gestational carrier. And that still stands, because often carriers sign up and they want to be pregnant today. They are as excited as you in a different way. And so if you have embryos, absolutely, it can go more quickly. But I do not want people that are watching this webinar who maybe have been waiting in Canada with CFC or another agency who've been waiting a great deal of time to go, hey, I've been waiting a year, because there are definitely exceptions to all of the rules, and all agencies in Canada do their best to get people matched as quickly as possible and to find the right surrogate for the intended parent. So please know that 9-month average, we have people who've been waiting well over a year. We have had people that have had embryo transfers and they haven't been successful, and they've chosen to work with another carrier, and they're waiting there as well. And so we hope that it will be 9 months for people. We are not in the business of fast turns. We're not, we hold women able to come to this process. And so there are countries that, that I believe have faster times, whether it's a compensated model or whether it is sort of a less, I don't want to say a third world country, but I know in Ukraine and Georgia and Greece and some of those countries that, there is no wait time. And there are no legal contracts for reviews for surrogates, and the women maybe aren't treated as well. And so in Canada, in an altruistic process, there, we respect all of that.
I think I want to say that although you're saying 9 months, that I think is the exception, not the rule in general. In my experience recently, I think you guys are doing such a great job in recruiting surrogates now. And I can tell you that the last 3 people I called, I said, okay, your embryos are ready, they're genetically tested. I say, okay, now's a good time to find a surrogate. And they say, Dr. Liebrecht, we already have a surrogate, we're ready to go. So I think there can be quick turnover sometimes.
Yeah, absolutely.
I mean, we want to give reasonable expectation, but also if you're struggling to find a surrogate, talk to us. Maybe we can look at other options as well.
I think it's critical to have really good service providers, which is clinic, agency, and lawyer, because if we're working together as a team, we're there for you. And one might say, I might be accused of putting pressure on the agency to find a match for my clients, given what I do in the industry, but I do it for you, so it's important. And the other thing to think about with the other countries is not just the ethics, but the wait time to get home, especially if you live in a country outside of Canada. I have heard that in some places it's taking 3 to 4 months to be able to leave that country. Canada is, if you're domestic and you do it in another country, we're a lot faster. But you've really got to consider whether that's going to work for you and whether your home country will accept this child based on the ethical concerns that they may have in those countries. Because a lot of them don't have a true democratic government, which means it's slow to act. They have a government that can say at 10 o'clock in the morning, there will be no surrogacy as of 10:30 this morning. Whether your surrogate's pregnant or you have embryos, they're gone. You're in trouble. And you've really got to think about, this is baby making, not buying shoes.
Absolutely. The next question is, how long does the whole process take with your company, and what is the total cost for surrogacy? I think that it's really an individual process. I'm sure we'd all love to talk to you individually. Considerations around cost are, do you have embryos in your home country that you'll be shipping across to Canada? We are very lucky in Canada that we can receive embryos from anywhere in the world, unlike the US that has FDA requirements on embryos. The other consideration is, do you need an egg donor? Are you doing your own IVF cycle? Are you looking into a guaranteed program through fertility clinics such as Create, in which you pay one price to be guaranteed a live birth? So all of those questions are so good, and depending upon your situation, you'll be able to get a general cost. However, in Canada, we don't provide fixed cost pricing, because each surrogate has different expenses, different expectations. We do not cap bed rest, and while it's less than 5% of surrogates are on bed rest for longer than a 2-week period, we do understand that the majority of our surrogates are working outside of the home and do have expenses, and we really want to be as respectful around that as possible. And so that, again, is something to consider. So please reach out to us. We'll be sending an email with our contact details. We'd love to connect.
Another thing regarding costs is, we have at Create, we have 3 programs for guarantee. We have a guarantee of 1 baby, we have a guarantee of 2 babies, and we also have, for same-sex male couples, a guarantee 1+1 baby for each of the 2 couples. And I think it gives you a sort of peace of mind knowing that you'll have a guarantee of a baby, or you'd have financial compensation. The other thing I was going to say is that if you compare other countries, the US is probably the most expensive in the world. It's about double the cost. It's about half the cost in Canada as it is in the US, because remember, you're paying Canadian dollars, not US dollars, which are much less. And so you're able to do this at a much more economical level, especially when finances are tight and you need to save a lot to be able to do something like this. So I think that's really a nice thing about Canada, that you have costs are going to be generally less for pretty well everything that you do.
Yeah, the dollar is a huge factor for us. I just came back from Sydney. Somebody asked Dr. Liebrack if they can transfer their embryos that they have at another clinic here in Canada to you.
Absolutely.
You should.
Thanks. 100%. We'll accept embryos from other clinics, other countries, anywhere that you want to send them to us. We will be happy to accept them and be able to use them. If they were not genetically tested, we can even test them. There's ways to do that. Our clinic is very adept at doing that for people that have not had genetic testing on their embryos. And there's no problem whatsoever. And shipping is not a problem from anywhere in the world. We actually have at Create a embryo transportation team of people that we just, there's an email you send, embryotransportation@createivf.com, and they just take care of everything and help you to organize all your transportation. So it's something that we can easily do for you from anywhere in Canada or around the world.
And someone else asked a question, what is the success rate from shipping embryos from Australia to Canada? I imagine that question is, what is the success rate of the embryos arriving and being safe and opening up the shipping container and them remaining frozen for that long flight? So if that is the question, I can tell you in 18 years, we have had one issue, and it was literally a small plane crash, to Vancouver Island, which Toronto is a big city. The flights are, large planes. It was just a very one-off. And again, thousands of our clients have shipped embryos from all over the world with great success to Create.
I imagine the question interesting as one for you to answer, which is how good are the embryos that you're getting from Australia
okay.
as a possibility? Interesting.
Totally.
Well, I
Different.
mean,
I love
obviously,
perspectives.
it depends on the clinic and their ability to freeze embryos. Nowadays, technology for freezing embryos is incredible, and we get 98% survival of embryos that were frozen, at least from our own clinic, and it's pretty close to that from other clinics in the world. We do love to have embryos that are already genetically tested, because that's going to significantly increase your success rate. But you don't have to worry really about embryo transportation, because the companies are very professional and they really do an amazing job at transporting embryos. So there's no problem
They're
at
coming
all.
with an individual on the
Yeah.
plane, right?
Yep.
So the cost is really that person's, well, most of it is that person's plane ticket.
Yeah.
And sadly, they don't like to go economy
They're
all the time.
often hand carried. That's right.
In
So-
terms of the next question, and for the person that is looking at shipping their embryos from Australia, again, getting started on that process as soon as possible, as over the years, we've all recognized that Australia, depending on the state you're in, may not release embryos as quickly as here, where you could call your clinic and say, I'm coming to get my embryos, I'm going to take them in a taxi to the clinic down the street. In Australia, there's often ethics committees and moving parts around shipping your embryos. So my suggestion would be to connect with a lawyer who will be able to advocate for you at the clinic level in Australia. And Cindy could definitely refer you to that person who has a lot of experience working with Australians coming to Canada. There are some honestly just fantastic lawyers there as well.
Yeah, I have lawyer colleagues all over the world. Somebody also asked about gender selection in Canada.
Oh yeah.
So there's two aspects of that. The overall is no, there is an exemption if there's a medical issue, which Dr. Liebrecht should answer and explain. But it is a very high priority for me, up there on my bucket list. And I realize the word priority really means one thing, but we've changed that. I have many priorities, but to change and argue that law all the way up to the Supreme Court of Canada if need be, because I feel that we should be able to select gender as a desire of what child, or especially if we're finishing a family and we have one gender, we want another to complete it that way. The purpose behind it and prohibiting it was to make sure that we didn't demoralize one gender or prefer one over another. And I think you can ferret that out through psychological assessments on cultural basis or that kind of perversion. But for parents who simply say, I relate more to a girl, I relate more to a boy, I think it should be allowed. And South Africa a few years ago ruled that it was unconstitutional to prevent it. Dr. Liebrecht was very helpful in introducing me to the professor who argued it, who's provided his materials, and I swear I'm going to get to this. But the exemption is a medical one.
Anyway, the reality is that it's illegal to select gender based on just social reasons right now, but hopefully Cindy will be successful in her changing the law. But in terms of gender for medical reasons, so if you have in your family a disease that affects males and you want to have a female, or females that you want to have a male, then that is doable. An example that's kind of gray a bit is autism. So autism is about 8 or 9 to 1 in boys. So many people that have children with autism will want to have a girl to avoid the risk in their child having a child with autism. So that's an example of something that we can do. Or there's muscular dystrophy that happens in boys, and that could be a reason to select female. So there are many different conditions where you may select one gender over another, but it has to be for a medical reason.
Excellent, thank you.
By the way, one thing we can do, if people, they're insisting that they do want to have some sort of gender, we can ship embryos to other countries where that can be legal. So it is possible to do that. So there are some options there, but it's not something that we normally, we really want to have a healthy baby. That's the most important thing. And I hope most people, that's the reason why they want to have a child, to have a healthy baby.
And I'm of the opinion that if your embryos are in another country like the US and you want to do the process here, you could order your clinic to only ship certain embryos to the Canadian clinic. And as long as you, Dr. Liebrecht, and your staff have no idea why that was and didn't do anything, well, you might know why, but you didn't do anything to facilitate that other than accept good embryos. I think it would be unethical for you to transfer an unhealthy embryo for the purpose of gender selection. But I don't think anybody would really do that.
Mhm.
I think Cindy and I are both very curious about that. Not that either of us are having children, but we're both girl moms. I have 5 daughters and Cindy has 2. So this whole family balancing information would have been great years ago, but here we are as girl moms.
I wanted girls and I got 2.
Well, I guess it's only me. Okay. We have our embryos at Create. What are the implications if we move to Montreal in terms of surrogacy? Cindy, that's all yours.
That's my client.
Oh,
So yeah, we're going to talk about that. So your issue is that if you move to Quebec and you have a surrogate in Quebec, you will have had to have lived there for a year. So that's a problem for you. If you move to Quebec and your surrogate is in another province, it's not a big problem. There's some hoops now. There's a requirement to have a special counseling session with a special counselor who's accepted by the Quebec government. We call it the Ministry of Health. They have a different name. So there's some hoops. One of the issues about having a surrogate in Quebec, apart from residency, for those of you who don't have that issue, is that the reimbursements have to be managed by what they call a notary, which is not the same as a notary public, which I can have, and anyone, travel agents can get a notary public. Notaries are a different kind of lawyer almost. They're special status. And the current state of the law requires them to manage the reimbursements, which is rather awkward since none of them have surrogacy experience. And I imagine if I was a surrogate, I really wouldn't want to have to explain the need to get someone to cut my toenails to the notary, nor would I, as a notary at a higher rate of hourly, want to hear about it. So I think those are some issues that the agencies and the lawyers are working out now. So you just need to make sure you're working with a lawyer who knows what's going on. So we'll be talking. Just call me and we're going to get through it.
Okay. Do you help to find a surrogate mother? Absolutely. So in Canada, there are many intended parents. You know, I always say an agency is like a wedding planner. There are many intended parents within Canada who are able, through the use of social media and, you know, being very open in their community, are able to attract and find a gestational carrier and to work with their lawyer to create a contract and then to reimburse the surrogate based on that contract. For many other people, they may be private. They may not want to share quite yet what they are doing, or they may be busy and they may not want to, go on their own to look for a surrogate. And so, yes, Canadian Fertility Consultants absolutely helps intended parents to find gestational carriers. And as we do, and for intended parents who are listening, prior even to talking to an agency, as I mentioned earlier, the agreements with yourself, the agreements with your partner if you have one, and then the agreements that you eventually make to your surrogate are key. So how do I feel about surrogacy? What is important to me? Would I terminate for a medical abnormality? What type of relationship do I really honestly want or have capacity to be a part of? And that's during the relationship and after. How many attempts would I try with a surrogate before I would just say, this is our budget is exhausted, I'm not going to move forward anymore? So having those questions answered by yourself, and I say to intended parents to ask them separately write them down and compare notes. And then from there, articulate that to the agency. Be really honest about the relationship. There's a surrogate for everyone. It may take longer based on what your criteria are. However, I will say that having those conversations early will give you much more of a chance of success in recruiting a surrogate, because once someone meets you, they will see that there is a genuine authenticity, that what was in your profile really is who you present as. And so whatever those needs are, really important to share them with your case manager. And then at times, your case manager may push back and say, hey, asking your surrogate to eat a vegan diet when she is from Alberta and is a farmer, that might not work. And so if you want to expand, here are some stretches for you to do, to think about and sit with. And as you do that, it will become clear as to what really is an immovable value, termination for Down syndrome, chromosomal abnormality, versus vegan, eating meat, eating McDonald's, those pieces. So absolutely, we would love to connect with you about surrogacy. And again, when you receive the recording of this, you'll also receive contact details about how to connect with Canadian fertility consultants.
Is everyone seeing each other's chats?
Yes.
So the names aren't private. Okay.
No.
So Tim, I think I answered your question. You wrote again and then said amazing things. But yeah, you need to do the counseling. So I'm working with an educational service provider in Quebec that helps people in Quebec manage these new rules and has an in-house approved counselor, and I'm making those referrals, and you can do a 2 to 1.5 to 3 hour session as required, and they're going to support everyone through it, and they're not very expensive. So contact me and I'll help with that.
So the other question is, it says, the common problem that we see in Canada is clinics give option to the surrogates regarding the tests and close monitoring of medications. They say it is low. Does create work for IPs or surrogates' interests? Mm-hmm. So I want to just give a piece of advice before Dr. Liebrecht shares. Taking care of your surrogate means taking care of your baby. And we have learned over the years, I was a surrogate 20 years ago and I was on all kinds of medication. We're learning now that success rates look very similar, and Dr. Liebrecht's going to share more on this, but we see as an agency that success rates look very similar when women who have achieved pregnancies naturally are on less medication than more medication. And so surrogates advocating and having these big conversations with their fertility clinics around medication use and becoming informed consumers. While they aren't a consumer in terms of paying the clinic, their health and respecting that is so important. So Dr. Liebrecht, can you talk a little bit about, how you balance the needs of intended parents and surrogates? I know you touched on it at the beginning, but in terms of medication, medicated cycle, natural cycle.
Well, look, the interests overlap. If your surrogate has a healthy pregnancy, it's more likely you're going to have a healthy baby. So we want to make sure that everything goes smoothly for everyone. And we have to, both of those people are our patients, but at the end of the day, the baby that comes out, we want a healthy baby. So I think that's really important. I'm not sure if there was another question in there. It was about,
I think it's actually not necessarily the clinic, but it's care providers. So healthcare in Canada often looks very different, and we hear from intended parents, why isn't my surrogate having an ultrasound every week? Why isn't she having this test or that test? And often in low risk, uncomplicated pregnancies, we see, currently almost 40% of gestational carriers delivering at home. Theirs are the intended parents, with midwifery care. Absolutely within your legal contract, there will be the requirement and expectation that the carrier go for all tests as prescribed by Health Canada. And you can go on to the ocanada.ca website, click pregnancy, and you'll be able to see all of the tests that the government, that Canada suggests for women. And that looks very different. And that can be scary. And that's, being able to bring that yourself forward with that of like, wow, this looks very different. And doing that with your agency or with your doctor at home, but really protecting your surrogate from that. And if you're wanting to have her do additional tests, finding out, is that even possible in Canada? Because oftentimes with our social health care, which by the way covers your carrier's pregnancy care for free.
Well, we pay taxes.
We pay taxes. Your carrier pays taxes, your surrogate pays taxes. And so her health care is free. And, you know,
it's important to point out the baby's healthcare.
Yes.
If you're international, is not free.
Yes.
So if you're anywhere in Canada, it's free for surrogate and baby.
Yes.
But outside of Canada, you must get insurance for the baby.
Absolutely. And your lawyer, your agency, your clinic will guide you and have a requirement that prior to the embryo transfer that there is proof of insurance. We all deeply respect the Canadian healthcare system and, you know, want to ensure that we are keeping it going. And so this insurance has been in place for a number of years, and we find that there are policies that cover directly to the hospital without co-pays or any of the issues that you hear about in other countries.
You know, I often get accused of sticking my nose in the business of agencies and clinics when I give advice. But I find that when I ask the questions, and maybe it's the experience of having been a criminal lawyer or the way my parents raised me to constantly demand answers and more questions. When I find this kind of question comes to me, you know, I find with a little bit of asking and communication, delving into it, that it's not that the intended parent wants to control, it's that they don't have the education. I get asked, can we cap bed rest? And I go, well, if she runs out of it, do you want her to go to work, or should she pay for your baby? Because she's probably going to go to work and have a miscarriage. So no, you can't cap it. And then they just say, oh, okay. So you have to talk to the clinic to say, why are we doing this medical protocol? There should be a meeting so to make sure you're comfortable and you understand. I've had clients who didn't understand what a midwife was really like in Canada. And the negotiations went forever until finally I asked the surrogate to go to the intended parents and say, what's your objection?
Right.
And they just didn't know what it was. In their country, it's a terrible service. So then that was relieved. But it's important to understand that legally, women, all patients have control of their body. Doctors can't force things on people. And particularly women have agency in how they manage their bodies. It's a constitutional right. So it's important to respect those values. And if you have a question, a doubt, it's so important for you as an intended parent to be comfortable. Ask the agency, ask the clinic, ask your lawyer to help you if you're afraid. But just ask. Don't leave yourself feeling uncomfortable.
I think having that compassionate inquiry and always being curious and coming from a place of, you know, of that curiosity, not what did you eat for breakfast, but hey, you know, I've decided to eat for two also. I'm eating as though I was pregnant. Here's what I had, and like it was great or terrible or, you know, whatever. And there are ways to share information with your surrogate. There's ways to prompt. There's, you know, organic grocery delivery. There are a million ways to show up for your surrogate. And our goal at CFC and through Sacred Surrogacy, our partner program, is to really ensure that people do have the opportunity to have, like I said, that compassionate inquiry and that curiosity with all of the service providers. You know, why are the tests happening? Why are the laws like this? Why is my surrogate like that? Why is my donor 17 days of stimulation when I did IVF? It was 12, you know, because we're going to answer you and then you're going to, you know, have your answers. Okay.
Has there really been a 17-day stimulation?
Well,
I
had that.
Sure.
I had that.
Oh my
we
God.
do dual stims.
Wow.
What is the first step one should
deserves
do
everything.
to contact? Okay, sorry. Let me read this again. What is the first step one should do to contact Create first to start the process? So yes, absolutely. We will be providing as we send this out. And Aaliyah, our amazing backstage technical person, if you could put the website of Create in for more information, and Hope Springs Fertility Law, CFC and Egg Helpers. But we will be sending this video out and we will all be following up with you. Please ignore our emails if you're already a client. But
and we try to see people as quickly as possible. Usually now it's about a week or two, the most. It depends on your schedule, of course, as well. If you're in Europe, we try to do it in an earlier time of the day. If you're in Australia, a later time of the day usually. It could be early morning too. So it all depends on where you're located as well. But we really try to do the consultation as quickly as possible because you're anxious to get started. You decide you want to have a child this way, and we want to help you as quickly as we can to get started, and we'll do everything possible to make that happen as quickly as possible.
We have one last question. Asking for a surrogate to stay in someone's house for 2 to 3 weeks or in a hotel to be monitored by a female, whether she is taking medications or injections, is it legal?
I don't think so. I think you may be confused about the donor versus the surrogate. So if a donor lives far away from her clinic and she's being monitored over a period of time, it's a matter of convenience that she stay close to the clinic. If she came to create and she lives 20 minutes away, she should go home unless she doesn't want to. But it's not an illegal thing. I have never heard of a surrogate having to be in a hotel for 2 to 3 weeks. So I think you need the donor. Surrogates come for screening from out of town because of when the flights are, they may have to stay 2 or 3
A surrogate
nights.
only needs to come to the clinic if they're far away to get their screening done for a few hours, really, of a day, and then they come back to the transfer, and usually they fly in, and if they're far away, to fly or drive, and then they go home the same day or the next day. So they really don't need to be at the clinic very long at all. And we have lots and lots of monitoring remotely for surrogates and donors to get them started. Donors generally are here longer because they have to go through a longer process to provide eggs, and so they're here for usually about a week or a little bit more.
It just dawned on me that maybe your question is, if you wanted to have them stay in your house, you're inviting your surrogate from out of town to stay with you.
It might be,
if that's the question.
And I know that often
Sure.
intended parents during that first 2-week wait of, the embryo transfers happen, we're waiting 2 weeks for a blood test. I mean, do you put her in bubble wrap? Do you not let her get on a plane? I remember my first intended mother, right? My first intended mother wouldn't let me go through the x-ray machine at the airport. So she followed me through security and then asked them if they could take me through and pat me down because she was so nervous about that. And so if that's what's up for you, I completely appreciate that you are wanting to keep your baby safe or the embryo safe and care for your surrogate is what I would imagine. And that's very lovely. And I think making that arrangement with her, knowing that she likely has children at home and other responsibilities, that may be available to some surrogates and they may be up for that. So I think it's lovely if that's what you're offering.
It's perfectly legal, but I think for the comfort level, you probably want to raise it with lawyer and agency to let them be the go-between so that the surrogate, she may love you, but staying with you for 2 to 3 weeks,
might be
nobody would want to stay with me for 2 to 3 weeks.
My children during their egg donations wanted to stay with you forever.
They could. They didn't.
So thank you, everyone. Your questions were fantastic. We will be getting a copy of this out to those who couldn't attend, as well as information on how to connect with Create Fertility, Hope Springs Fertility Law, Canadian Fertility Consultants, and Egg Helpers.
Thanks, Gareth. Nice to see
Gareth, yes, it's so good to see you. And yes, we will catch up with you soon. Thank you so much for joining us.
Thanks, everybody. Thank you.